Hey guys, Dr. Stephanie here, and today we're talking all about the hip flexors. So the hip flexors are those muscles right here in the front of your hip. A lot of people know it as the iliopsoas or the psoas, and those muscles are the ones that bring your knee up towards your chest in this motion. A lot of times they feel tight or weak because we do a lot of sitting, and those muscles get shortened. We do a lot of kind of leaning forward movement. Those muscles can get shortened and tight and weak, and we can feel pain or tightness in that area, sometimes a little bit of pinching too. So in order to counteract that, we really need to work on strengthening those muscles. It may feel like you need to work on stretching or mobility, and while that's important, it's also important that we get those muscles strong so they're functioning properly. That can also put us in better alignment. If you feel like you have kind of an anterior pelvic tilt, your pelvis is tilted forward, then this can actually help you get you in a better position, can help improve posture, and just reduce any discomfort you're feeling in the front of your hip. So I'm going to go through 5 exercises that will help strengthen those muscles and relieve any tightness or discomfort that you're having there. So for the first exercise, I'm going to grab a band here, and you can use any sort of loop resistance band. I like the elastic ones, but also I like these fabric ones sometimes because they don't roll like the other ones. They're a little bit more comfortable. So for the first exercise, place a band around your feet here. You want your feet about shoulder width apart. You really just want some resistance in the band. So you don't want your feet too close together so the band kind of just falls and there's no tension there. So stand up really nice and tall. If you need to hold on to something, you definitely can. For this one, we're just going to bring a knee towards our chest and then put your foot down, and then same thing on the other side. You're going to alternate back and forth, really working on pulling that band up as high as you can pull it. That's working on building that strength in the hip flexors. And this also works on balance. So if you feel like your balance isn't that good and you're not ready to do this totally unassisted, definitely hold on to something because you want to work on that hip strength and you don't want to be struggling with your balance as you do this exercise. So just back and forth, and try not to rock too much. Keep that pelvis even. You want to do this for about 30 to 45 seconds, probably 30 when you first start, and then gradually increase. And then repeat that 2 to 3 times. And that'll really focus on strengthening those muscles here. Okay, we're going to take the band off, grab onto a little yoga block. If you don't have a yoga block, you can use a step or even a thick book, or you can just do it on your stairs. This is just going to give us a little bit of height. We're going to do a kettlebell lift, and so it's just easier than doing it flat on the floor. You want a little bit of height on the other leg. So stand on here. If you need to hold on, definitely hold on. You're going to place one foot through the kettlebell. If this is uncomfortable on your foot, you can put a shoe on. I just don't have shoes on for the rest of these, but you can definitely wear a shoe. Sometimes, probably not a thick shoe because it may be hard to get your shoe through the top of the kettlebell. But for this one, and you can hold on for balance. Sometimes you can put your hands on your hips for balance too. You just want to lift this kettlebell up towards you like that. So kind of like the last exercise, except we just have a kettlebell. So just lift up and then down, nice and slow. You don't want to do this too fast or let it just drop to the floor. This is a 10-pound kettlebell, but you can start with a smaller kettlebell. Just whatever is challenging for you, but not too difficult. So just lift up 8 to 10 times, and then you can do the same thing on the other leg. I would repeat that 2 to 3 times. So 2 to 3 sets of 8 to 10 reps. Use a weight that is good for you, so not too difficult, but still a little bit challenging. Okay, for the next one, we are going to sit on the floor. Okay, so for this one, grab some kind of object. I'm using my yoga block because I have it right here. Just going to place it in front of you, move this band to the side of your legs here. And from here, we're just going to lift our leg up and over and then back. So you're just going to lift it up and over here and then up and over back. And you want to try not to lean back too far. Try to sit up straight if you can. And if this is too high, you can turn it on its side. You can use a smaller object. You can also start with no object. just move it out of the way and just lift up and over, and then use an object when you're ready. You want to do about 8 to 10 reps, and then place the object on the other side, and same thing here, just back and forth. 8 to 10 reps, and then 2 to 3 sets of that. This is really working on hip flexor strength again. It takes strength in that hip flexor and that quad, because you want to kind of tighten your quad muscle here to lift your leg like that. All right, then for the last 2 exercises, we're gonna grab our band again, place this band around our feet, and then lie on your back. So there's 2 variations of this exercise. The second one is going to be a little bit harder than the first. For the first, you're just going to bring your knee towards your chest and then back down. Alternate bringing your knee to your chest, pulling against that band, keeping the opposite foot on the ground as you do it. Just back and forth, nice and slow. I would suggest doing this for about 20 to 30 seconds, and you can increase that time as you get stronger. And then repeat that 2 to 3 times. And then you can do both of these exercises, but if the second one is too tough, get good at the first one and then move to the second one. So for this next one, we're going to put our feet in the air, bend our knees like this, and then going to straighten one leg here and then back, straighten the other one, and then bring it back. This is a great core exercise as well. We want to make sure this leg is staying in place while the other leg straightens out. Go down and back, and down and back. It's alternating back and forth. And you want to do that for about 20 to 30 seconds to start, and then repeat that 2 to 3 times, and you can increase that time as you get stronger. So all 5 of those exercises will help improve that hip flexor strength and should help decrease any tightness or discomfort you feel. You can do those exercises. I would suggest every other day, maybe 3 to 5 times per week, and then just be consistent with them. You'll gradually work up that strength and get rid of any tightness or discomfort you feel.